Courtney, thanks for being with us. Why did you want to take a closer look at the COVID-19 data?
Well, I was noticing that there were a lot of reports in our area around Ontario, specifically Akwesasne, Ganawage, and Six Nations, where the reports for the numbers that were coming out of our community a few weeks ago made it seem like we were the only community that had any cases. If you were comparing the community reported data to that Indigenous Services was thinking about happening in communities. And that didn't make sense to me because I had seen from different news coverages that there were other communities that were reporting cases as well. And so I wanted to kind of confirm the data that was being presented by Indigenous Services Canada and just to, understand what was happening there. I work primarily as a researcher, as a policy analyst when it comes to missing and murdered Indigenous women. And I know from the National Inquiry, they raised a number of issues around data collection, and they weren't able to define a clear number of the number of Indigenous women that are missing or have murdered because the data collection isn't there. And I suspect that was likely the case also in this health information data. And so that's why it was important to me to actually compare these numbers and figures and challenge what Indigenous Services was reporting.
And so what are you finding, and what methods do you use that Indigenous Services isn't?
So Indigenous Services Canada is only reporting the number of cases that are occurring on reserve. They are not reporting cases of people that live in urban centers, and they are not reporting a fulsome Indigenous picture. They're not reporting cases around Métis or Inuit. Sometimes they'll do updates around Inuit communities, but that's separate from their total as well. And I know that, people that are First Nations and Indigenous recognize the fact that we have relationships with people that don't necessarily live on reserve. I have family that lives in urban centers. I have family that lives in the U.S. And so I'm more interested and I'm concerned about some of these other areas as well, not just exclusively what's happening on reserve, but also because there's that relationship. People that are away at school might be coming back as schools were canceled. That spread from urban centers was likely going to occur and happen into on-reserve communities. And being prepared for that, understanding, in urban centers, what Indigenous people are contracting COVID-19, what their relationships are to our communities, that's something our community should be aware of.
So what number did you arrive at, and what does the discrepancy between that number and what the government's presenting and the reality on the ground say to you?
So I was able to find about 465 cases of COVID-19 that had been reported by on-reserve communities, whether that is, by Indigenous communities. So that would include on-reserve communities, but also urban centers and the different public health agencies that are also reporting and collecting data around their communities, and then different local reports. I was also able to find 7 different people who had died because of COVID-19 that were First Nations. Right now, Indigenous Services Canada is only reporting that there have been 2 deaths when we've been able to identify 7. So it's actually 3 times as many deaths, which, people are saying, 7 isn't that many, but it's still a lot when you consider they're all recognized as elders in the community, and those communities are impacted with the loss of cultural knowledge that those elders had.
Well, Courtney, important work. Appreciate you sharing some of it with us here.
Thanks.